Welcome to the Sexual Health Unwrapped podcast, a conversation with a sexual health expert which answers common questions about sexual health and well-being. We want to answer the questions you might be a little bit uncomfortable asking. I'm your host, Alfie. I'm a member of the Axess Sexual Health team, and today I'm joined by my guest, Dr Martyn Wood. Martyn is a specialty clinical director at Axess Sexual Health and a consultant in genitourinary and HIV medicine. Martyn's going to be chatting with us today and answering questions about syphilis, a bacterial sexually transmitted infection, and doxyPEP, a doxycycline antibiotic which can help prevent bacterial sexually transmitted infections. We're going to be unwrapping and exploring all the important questions about syphilis so you can better understand your sexual health. Martyn, welcome to the podcast. How
Hello.
are you today?
I'm very well, thank you.
So for our listeners, could you just give a little background into your job role at Axess Sexual Health, what your sort of work involves?
Yeah, so I'm a doctor. So I've been a sexual health and HIV doctor for about the last 20 years. So I've seen a lot of things change, but my main role in clinic is to assess people's sexual health, and that's whether we're looking at preventative treatments or preventative measures to keep people from getting STIs, or if people have symptoms, assessing, seeing what's going on and getting people on the right treatment. So big part of my role is prevention, keeping people well, but it's also treatment as well. So it's quite a wide varied role.
And what sort of made you want to work in sexual health in the first place?
I thought long and hard about the answer to this question. Over the time I've been a sexual health doctor, things have pretty much completely changed in the sexual health world in terms of what's available to us. But the core of what we do, and one of the reasons I really love being a sexual health and HIV doctor, is that pretty much universally somebody comes into my clinic room and in the majority of cases they'll go out feeling better. Sexual health's really emotive kind of topic. There's still loads and loads of unnecessary stigma around STIs and sexual activity. People can carry that about with them. So a lot of our job is unpacking that, allowing people to have really healthy and most importantly enjoyable sex lives. So a big part of my job is basically letting people fulfill that.
Mm-hmm. Well, that's really useful to hear for the podcast today, because that's sort of why we're here, is to sort of break down barriers about sexual health and get to really know the questions about get to answer the questions about sexual health that people might feel a little bit anxious asking or a little bit uncomfortable asking. But to continue talking to you a little bit more about your work life, if someone was hoping to maybe get into the field of sexual health, how would you kind of advise a route into that, and what sort of mindset do you think people have to have?
Yeah, I think so. There's lots of different roles and lots of different backgrounds in sexual health. One of the things is a real kind of bonus about our team is that we have lots of people from lots of different backgrounds all working together for the same purpose, really. So I've got a medical background, so my specialty is genitourinary medicine. It's a hospital medical specialty. So my background is that I went to medical school, I was a junior doctor, and then I chose sexual health to be for my specialist training. So that's the kind of the doctor route into it. We have lots of different roles. So the nursing role within our clinic come through, again, a nursing training, but then on the whole tend to come and work for us without any previous sexual health knowledge and kind of train as they go. So that's the qualified nursing and medical routes. We have lots of other different routes, which I'll go through. So we have our health promotion team, which are a very important member of, who have a huge different background. And I don't think there's any one thing that can say where the background that people have come from. The key, the golden thread that works through everything is people want to make a difference to people, and people care. Basically being open, honest, and listening, and by far non-judgmental. People come into any type of sexual health and environment, and people think we're going to be judging them, making assumptions about the way they live their lives. We're not, and I think that's the one thing that hopefully doing things like this gets across, is that sexual health, whichever route, and we've got lots of different clinics, we've got outreach, we've got our Sexual Health on Wheels van, however you contact the service, you're going to be listened to and you're not going to be judged, and we'll help you the best we can.
Yeah, I think that is something that I hear from a lot of people who work in sexual health, is that, you know, it really is your day in, day out bread and butter, that you're helping people to enjoy their sex lives and feel more comfortable talking about sex, and feel, you know, less anxious to come into a clinic or nervous to talk about your sexual health. And I think patients coming into clinic might enjoy hearing that, you know, it's something we're so comfortable with and something we're so familiar to, that there's really no reason to feel any embarrassment about coming in and talking to us.
I think the biggest barrier is just that first step, because it can be really daunting. It's that booking that appointment, whether that's an online appointment, coming to one of our walk-in clinics, or just turning up. It takes a lot. If you've not been to a sexual health clinic before, that can take a lot, and it can be really nerve-wracking. And I think it's just really reassuring people that do that and you won't look back. We'll look after you.
Mm-hmm. Yeah, and I mean, I know full well from getting to know all the staff at Axess that everyone's in it for the right reasons, to you know, get people to feel better about their sexual health. So you know, you're in safe hands when you come into a sexual health clinic. And it sort of brings me on to our main point of discussion. I think, you know, something that people feel probably a big barrier to talking about is sexually transmitted infections, which today we're going to talk to you about syphilis, which is a specialty of yours. So tell me about your background in syphilis and your understanding of syphilis.
So part of my specialty is, as well as the preventative aspects and all the preventative things we can do, it's actually treating sexually acquired infections. That's the core part of my work. So there's a whole host of STIs that we treat, but some STIs are a little bit more complex than others and can cause more problems with the body, more complications. So syphilis is one of those, and along with HIV. So because I'm a senior doctor, I spend a lot of my time in terms of treating conditions, managing syphilis and HIV. So they're two of the main infections that my role as a doctor in treating.
And so I think for us who work in sexual health, you do become quite familiar with different aspects of different sexually transmitted infections. But I think when I first started working in sexual health, there was a lot I didn't know. So for someone who really has no understanding of what syphilis is, can you give an overview of some of its symptoms, how it's transmitted?
So syphilis it's a bacteria. So it's as simple as that. It's a bacteria that is predominantly transmitted through sex. So, and it doesn't have to be penetrative sex. It doesn't have to be sex where you're not using condoms. It's an infection of close sexual contact. So what happens? It's a bacteria. The bacteria enters the body normally through breaks in the delicate tissues of either the genitals, around your bum, inside your bum, or at the back of the throat. And it kind of sets up home in that area. You get a lot of inflammation, and the first thing that you tend to notice is a sore, or what we call an ulcer. That tends to carry on for a couple of weeks. A lot of people will have no symptoms at all, because if you get an ulcer in your mouth, getting ulcers in your mouth is really common. So a lot of people wouldn't know that they've got a syphilis ulcer in the mouth. The same with it being inside your bum, you're not going to notice it there. So commonly, if you do notice symptoms, and a lot of people, about 50% of people won't notice symptoms, it will be an ulcer on the genitals, and that can be painful. In some cases it's not painful, but I think anything where there's lumps and bumps or ulcers or sores, come and see us, because it can be a few things, but syphilis is one of those things.
Mm-hmm.
If people don't get symptoms, or they, as often happens, people ignore things and hope they go away. I think we're all guilty of that. That ulcer will spontaneously disappear off, so it'll go away on its own, but that doesn't mean the syphilis has gone away. What's happening is that syphilis bacteria is making its way into other bits of the body. So it goes through your immune system, so you get the immune tissue in your groins and often under your arms swells up. So if anyone's had a cold or a flu, when their neck glands go up, you often see the glands getting bigger across the body. So that's one of the first earlier signs of syphilis. If syphilis isn't picked up then, the syphilis bacteria can basically affect any bit of the body, and that's why it can be cause problems if it's not picked up early enough. So the commonest symptom is, if you don't after the ulcer, is that you get a rash. So it's normally a bit of one of those rashes you don't quite notice it sometimes. It's not particularly itchy. It's quite often in bits of your body you wouldn't necessarily see. So quite often people don't notice the rash and it settles naturally. Now, one of the commonest ways we find syphilis or diagnose syphilis is on a blood test in somebody that's got no symptoms at all. And that's why having regular STI screening, if you're changing your sexual partners, is really important, because you might have an infection that you don't have any symptoms for. The bit where syphilis can cause problems, and the first thing to say, syphilis is completely treatable. It's a bacteria. It responds really well to antibiotics, to penicillin, which is a really old antibiotic, but it's very effective against syphilis. The difficulties and problems that we can have is if syphilis has started to affect bits of your body where it can cause damage. So a less common but serious complication of syphilis, it can cause problems with your vision. So people can have their vision affected or their hearing affected. Syphilis can affect any bit of your body. So it's really important to get diagnosed early, and the best way to do that is to have a regular sexual health checkup and find it before it's caused any problems.
So how often would you encourage people to go for a test?
I think everybody is individual in their kind of needs for how often they need to have a test. We tend to say if you're changing sexual partners or you have a regular sexual partner but you have sex with other people, we would recommend a test every 3 months. Now, if you're not having sex that frequently or it's less frequent, we'd recommend that you have a test after any new sexual partners, really. So it depends on how much sex you're having or how many different partners that you're having. But everybody's different, and if you're not quite sure, a test every 3 months.
Yeah, and I think it's useful to know. On top of that frequency of testing, the level of accessibility of testing, it's completely free to do. If you live in our service areas, you can order a test online. So there's no better reason than to get tested.
So I think I've been in sexual health a long time now. When I just said 20 years, that shocked me a little bit. It has been 20 years. Things have completely changed in the way that you can access tests. When I started off in sexual health, you couldn't come to any clinic, you had to come to the gum clinic, as it was called then. That was the only place really you could get an HIV and a syphilis and a chlamydia test. Things have really changed now, so the accessibility of testing. So as you say, we now have postal testing. You can, if you've not got any symptoms or any concerns, you can have a postal test and do all of those tests at home, comfort of your own home, get a text message or an email with your results. Lots of different venues do sexual health testing now. It's not just sexual health clinics, it's your general practitioner, it's your walk-in clinics. There's lots of places where you can access sexual health testing, and that's the main thing that's changed in my time in sexual health. Results are normally back within 24, 48 hours. again, a few years ago, you had to wait 2 or 3 weeks. And that was a really big barrier for people testing, and that was just the worry of that wait for waiting for a result. The majority of our results now come back within 48 hours.
Yeah, I think sexual health is definitely one health field where innovation is prioritised and happens very often, and I think that's something we're going to come on to certainly throughout the course of the podcast, but definitely in this episode alone we're going to speak about doxyPEP shortly. But to continue talking a little bit about syphilis diagnosis and treatment, what would you say to someone who is maybe feeling embarrassed about a diagnosis of syphilis?
I think a phrase that a colleague of mine used a few years ago, and I really liked the way that it was that he described something, and I've kind of stolen it, is sex is messy, and it should be enjoyable, and we're not going to judge you. No one else is going to judge you. I think when people come to our clinic, people think, oh, everyone's looking at me, they're all judging me. Everybody's worried about why they're there themselves, and they probably not even noticed you. So don't worry. Basically, we'll listen, we'll sort things out. But the one thing people worry about is being judged, and we're not going to do that. We'd never do that.
Yeah. Completely judgment-free space, and I think, you know, take into consideration everything you've said so far, it's completely treatable. You know, sexual health clinics are accessible in a judgment-free space, so I think that's really useful for anyone who's listening who may have recently been diagnosed or who may be looking to get a test. As I say, innovation is very common in sexual health settings, and a recent innovation is the introduction of doxyPEP in the UK. So what is doxyPEP?
Yeah. So there's been lots of innovation around preventative medicine. So basically medicine to prevent STIs and allow people to basically have the sex that they want to have. And doxyPEP is just one of those, along with a few other things, which I'm sure we'll talk about in a bit. So doxyPEP isn't anything too technical. It's doxycycline post-exposure prophylaxis. So I'll break that down. So doxycycline is an antibiotic. It's an antibiotic that's been around for a long time and is really used commonly in the treatment of some STIs, particularly syphilis and chlamydia. Post-exposure prophylaxis means taking something after you maybe have been exposed to something. So with syphilis, that would be from sex. So doxyPEP, it's been around for a good few years, but we've just been waiting for the evidence to amass to say that it's the right thing to do. And I think there's overwhelming evidence now that doxyPEP works in certain situations. So one of those situations is reducing the risk of getting syphilis if you're having more casual sex. So if you take a dose of the doxycycline within 72 hours, but ideally within 24 hours. Like anything, the sooner you take something, the better. If you have been exposed to syphilis at that point, the studies show us that your risk of getting the syphilis infection probably is lowered by about 60 to 80%. So it's a really, really effective intervention for preventing you getting syphilis infection. It also prevents against chlamydia infection as well.
Fabulous. So who would you recommend take doxyPEP, or who is advised to take doxyPEP?
So doxyPEP's open to everybody, but there are a few groups who may be at higher risk of getting STIs. And there's a lot of generalisation, so I think just because you are in one particular group, the sex that you're having may not put you at risk of STI. So I fully accept that. Sometimes we generalise so we can get the right preventative treatment to the right group. So I know that saying one group is at higher risk doesn't mean that everybody in that group is at higher risk. So probably the group that would get or will get the most benefit out of doxyPEP are the group of people who have a higher rate of syphilis, and that tends to be gay and bisexual men and other men that have sex with men. So out of that group would have the most benefit of doxyPEP. Now, we're not restricting doxyPEP to that group, but we're having different conversations with people that come in about their risk. 'Cause if somebody's risk is actually quite low, you have to balance potential side effects from treatments against benefits. So we know in gay and bisexual men and other men who have sex with men, that risk of getting syphilis is higher. It's the group that we see the most syphilis infections in. So it's the group of people that will derive the most benefit from that intervention. But there are other people with different risks who would also derive benefit from it. Where the evidence is at the moment, there's really good evidence for doxyPEP's effectiveness in gay and bisexual men and other men who have sex with men and trans women. The groups where the evidence is coming, the studies are being done, but we don't have as much confidence that we get the same level of protection are those people who have a vagina. So basically trans men and women. So we would still, somebody feels they're at risk, we would have that conversation about doxyPEP, but we don't have as much evidence that it's as effective in that particular group.
All right. And are there any side effects to doxyPEP?
Yeah. So doxycycline is an antibiotic. It's a single dose of antibiotic. So if there are side effects, that tend to be limited to a shorter period of time. But it's an older antibiotic, so it can upset your stomach. It can give you quite bad heartburn. But you can get around that by making sure you take the doxyPEP with lots of water and to make sure it gets into the stomach so it doesn't give you heartburn. In people who are really sensitive to the sun, it can lower the threshold for getting sunburn and being photosensitive. So we tend to recommend that if you've got doxyPEP on board, we recommend you wear a hat and an SPF. Because even if you don't normally sunburn, your risk of getting maybe a sunburn or photosensitivity does go up. And I think everybody kind of knows where they are on the sunburn spectrum, so it tends to manage that.
Yeah, I burn very, very easily, so that's where I am on that spectrum. Why do you think it's important for people to be aware of doxyPEP?
I think we've done over the years, syphilis is one, and I'm talking about syphilis prevention particularly here. Syphilis is, we've seen, despite increasing the amount of testing that we're doing, in people getting more tests, we see the rates of syphilis basically go up every year. So there've been a few years where there've been little kind of dips. So during COVID there was a dip. I think that was just because people weren't testing rather than not getting syphilis. The problem with syphilis is that if we don't diagnose it, it can cause problems. So it would be better if we can get preventative strategies in place so people aren't getting syphilis in the first place. And actually anything that reduces down the amount of syphilis means there's going to be less complications down the road, particularly with eyes and hearing and all those rare but can be quite serious life-changing complications. So doxyPEP as a preventative strategy for people that might be a bit higher risk of getting syphilis is a really important tool in a range of things to keep basically people healthy from a sexual health point of view.
I think it's interesting hearing you talk about preventative strategies as part of a toolkit, but because I think a lot of people do perceive sexual health as kind of one-dimensional maybe before they know about everything that's available to them, and it's something I'm going to come back to in a moment. But just for people who might be a little bit concerned about this next question, can taking doxyPEP make you resistant to antibiotics? Because I know that's something that does come up a lot, and it might be worth answering.
And there are some unknowns with doxyPEP. So we've certainly been using doxyPEP at Axess since earlier in the year. It's being rolled out across the UK at about this time. So it's a fairly new thing to the UK. However, doxyPEP's been really well used in the States for a number of years. So a lot of the information about side effects and problems and risks of doxyPEP comes out of United States data. Now, the big worry, or one of the worries, and it's not being borne out for it with the evidence from countries which have been using it for a while at this point, is that any antibiotic that you take can affect the natural balance of bacteria. So we all walk around with millions, billions of different bacteria living on us, living on our skin, living in our gut. Now, we're starting to realise that the bacteria that live in our guts have a really important role in keeping us healthy. And it's still not really that well understood. And there's loads of research and loads of study going on to how the bacteria in the gut basically keep us healthy. Now, if you take an antibiotic, there's a theoretical risk that the bacteria in the gut can be affected. So potentially one set of good bacteria gets pushed out and another bacteria overgrows. So that is one of the potentially the unknowns of doxyPEP at the moment, and that's where there's lots of studies going on looking at its effect on the gut. But going back to those countries which have used doxyPEP for years and years, we're not seeing that signal of significant harm or problems or multi-resistant infections. What we are seeing is a reduction in syphilis and chlamydia and the complications of those infections. And I think as it stands, the benefit of doxyPEP, if you are at risk of syphilis infection, far outweighs the risks at this point. Things may change, but I don't think they will.
That's really interesting, and it kind of helps me circle back to my previous point where you're talking about these preventative strategies and using innovative techniques to prevent the rise of sexually transmitted infections. What are some other current techniques being provided by Axess Sexual Health to slow the rise?
So I'm going to narrow this down to STI prevention, because there's loads of other things that we do that are not just about preventing STIs. There's lots of things that we do to improve sexual well-being, people's feelings around sex, and pregnancy risk or risk of getting pregnant with contraception. So we don't have time to talk about all those things. So I'm going to really concentrate on the STI prevention aspects of things. So again, just in the last, what feels recent to me, it's probably not that recent, there's been for the last few years, there's been a new preventative measure pretty much every year, and it's a really exciting time in sexual health. So when I started in sexual health, we did tests and we told people that they had to use condoms or they'll get an infection, and condoms are really important for preventing STIs, but they were the only real preventative thing out there apart from abstaining and not having sex. So things have really changed, and there's a whole kind of armory of things that you can use to enjoy sex and not worry about it. So I'll go through them. So a really important, a game changer over the last few years has been HIV pre-exposure prophylaxis. So we talked about doxyPEP being afterwards. HIV pre-exposure prophylaxis is a medication that you take before you've had risk and over the time that you're having maybe some risk. And when I talk about risk, I tend to mean condomless sex without condoms. So different ways of taking PrEP. You can just take it every day, so you've always got drug on board, so you're always protected. Or if sex is less frequent or maybe a little bit more predictable, you can take tablets around the time that having sex. So we know with HIV pre-exposure prophylaxis that it essentially is biologically nearly 100% protective against acquiring HIV. So that's an incredibly important tool.
Mm-hmm.
If you're already living with HIV, being on treatments with an undetectable viral load means you are not infectious to sexual partners, whatever kind of sex that you're having. So it's really important as part of testing is to know your HIV status. If you know your HIV status, if you're positive, if you're living with HIV, we can get you onto treatments, we can get your viral load undetectable, and you can't pass that virus on. So they're two really big important things. Looking at the bacterial STIs, we talked about doxyPEP, but there's a lot of vaccines out there. So the latest vaccine that we have available to us, we're going to call it the Men-B vaccine. We're calling it the gonorrhea vaccine. It's actually the meningitis B vaccine that's been repurposed. So there's a particular type of bacteria which can cause meningitis. It's very similar to the gonorrhea bacteria. So the vaccine that protects against the meningitis bacteria, meningitis B, there's a lot of crossover with gonorrhea and actually can protect against gonorrhea infection. Not as much as doxyPEP. So the reduction in risk is about 40% once you've had 2 vaccines, but being that there wasn't any prevention apart from condoms last year, it's a really, really big change and important thing, and it's something that we're doing in Axess. Lots of other vaccines. There's something called the HPV or human papillomavirus vaccine, which is a bit of a funny vaccine in that it is incredibly important because it reduces the risk of certain human papillomaviruses, which are like the wart viruses, but there's a whole family of them. Certain HPV viruses increase your risk of getting certain types of cancer. So that's penile cancer, vulval cancer, anal cancer, cervical cancer and throat cancer. And there's a vaccine that can, from a sexually transmitted virus, there's a vaccine that can reduce your risk of that virus causing harm and causing those particular types of cancers. So HPV vaccination, certain groups, is incredibly important, and actually that's been recognised, and you get an HPV vaccination in school now when you're 13. So there's a lot of people didn't, and we're essentially doing a catch-up vaccine for maybe that group that has a higher risk of getting HPV-related cancers, which tend to be gay and bisexual men again, and women under 25. So we do the HPV vaccination for gay and bisexual men and other men that have sex with men at Axess. For women that didn't get it at school, if you have a chat to your GP and you're under 25, you'll be able to have a catch-up vaccine with them. And then finally, there's the hepatitis vaccine. Hepatitis vaccines have been around for absolutely ages, but they're really important. There's 2 types. Hepatitis A, which is basically a really nasty type of food poisoning, but it can be quite serious, is completely preventable with a vaccine. Hepatitis A is a kind of a poo bug, so you can get it if the sex that you're having, if you get poo in your mouth or poo particles in your mouth. So if that's kind of your risk, hepatitis A vaccine is really important. Hepatitis B vaccine, again, hepatitis B is a viral STI. If you get it, it can cause a chronic inflammation of the liver. Again, completely preventable with a vaccine. So loads and loads of things available to us in the clinic.
Yeah, it's really quite amazing to hear the impact that some of these new innovations have had, and I think it would be very important of us as we kind of get to the end of our discussion to outline, if you could, how people can access these services. If you can give kind of a explanation of how people can get to Axess clinics.
Yeah, so hopefully we've made it as simple as possible. So if you look on our website, which is axess.clinic, a couple of different ways. If you've got an urgent problem, or if you've got symptoms, you're really worried about something, in Liverpool and all across all of our clinics across the region, there'll be a walk-in clinic that you can come to. If your problem's less urgent, or if you're looking for more preventative type interventions, it's probably better to try and book an appointment, because then things are a little bit more controlled. Our walk-in clinics do get really busy, but you can book online. You can phone up our team on our telephone number and book in, or you can walk in and ask for an appointment if the clinic's near. So there's lots of different ways. So that's the in-clinic services. Obviously, we've got our outreach team who are out and about everywhere. They're in so many places that I'm not even going to attempt to list where they are. But our outreach team will be somewhere near you doing pop-up testing. We've got Sexual Health on Wheels bus. So if you ever see that around, that goes to lots of events, and we can do STI testing there. And then if you've not got any symptoms and you don't feel you need to access, or you've already had them, or the preventative measures, and you just want STI testing, you can use our postal testing service, which can just go onto our website, order a kit, do the tests at home and get your results. But I would say if you've never been to one of our clinics, come in and see us, because there's lots and lots of preventative stuff that we can do. And it's that first step of coming into clinic. Don't be worried about it. We're really friendly, we're really nice, and we'll look after you.
Yeah, everyone's definitely very nice. Don't be afraid to come in and talk. And you can access all our services via our website, which is www.axess.clinic. Well, thank you for joining us, Martyn. It's been a really interesting discussion. And if you'd like more information about sexual health, visit www.axess.clinic. There you can find useful resources and guides which explain useful information on key sexual health topics. Thanks for joining us, and we'll see you soon.